All right, guys, Dr. Chad Peters at Rehab to Go. Well, this one is easy. This is for you sitting at home, the patient, the guy that feels like he has got a knife stabbed in his back. How this recording came to be is this happens to me all the time. It was the weekend, I was out doing my thing with my family, and I get a phone call from one of my buddies. Hey, Chad, it feels like there is a knife stabbed into my back. I hear this all the time. This is a really common thing in my clinic. So what's going on? You most likely have a rib out of place. That's right. Sounds crazy? Your ribs go all the way around the front side, all the way around the back side. You've got 12 on each side, and those things are built to kind of slide and glide a little bit. Every time you take a breath in, they move, or they move around. And on the side, sometimes they move like a little bucket handle. Now, if any of these things aren't moving the way they're supposed to, they cause severe pain. The pain you're feeling right now, the pain that got you to dial this in and find me on this site. So what are you supposed to do about it? You're looking for any exercises or tricks, or can I lay on a foam roller and make this thing feel better? Well, let me tell you what's happening. There is not a ton of pain. It's not a big issue. You really have a lot of pain for a small issue, and that's very common in stuff in the spine. The amount of pain you're feeling doesn't really correspond with how severe of an issue it is. In fact, with these ribs that aren't moving right, I typically equate these to having a paper cut. You guys have all had one of those. A paper cut's a tiny little issue. It hardly breaks the skin, yet it causes a ton of pain because there's a ton of nerves there. The other analogy I use is if you get a piece of dust in your eye. If you get a piece of dust in your eye and you're driving on the freeway, your day is over. You have to pull over and fix that before you can even continue on. Well, that's what's happened. Anyone that has ever experienced a rib position problem, their life is over as they know it until they get it fixed. Well, here's the good news. It almost always only takes a couple days, but it's not some fancy magic rehab trick. Now, before we filmed this video, I went and looked on Google and YouTube to find all the stuff I could be, and basically there's some ideas out there, but a lot of it is just a load. It's a bunch of crap to get you to try stuff or buy stuff, and it's not gonna work. Here's what's happening. The ribs sit in these tiny little capsules, and if they're not moving correctly, that capsule's job is to inform the body, hey, command center, something's wrong. The way the body fixes stuff on the spine is it locks all the muscles down tight. You know that huge muscle spasm you're having right now, and that knot you feel, the one you want your wife to work out with her elbow? That's not a knot, bro. That is a rib that's sitting out of position. So stop making her work on that thing and making you worse. Here's how you fix it. You treat it like it's inflamed. That's it. It sounds a lot like the lower back issue that we discussed on an earlier episode. But the thing is inflamed, and if you do stuff that brings more blood to the area, you are going to make this thing so angry at you. In fact, I bet half of you have already done that already. You get in a hot shower, you get somebody to dig their thumbs in there, or you use a lacrosse ball, or you sit on a foam roller, or you do whatever you can, a doorknob, a corner, anything, and it doesn't work. It just irritates it and brings more blood to the area. Now, when more blood comes to the area, it feels good temporarily, and then you can't tie your shoes anymore. So back off this thing, get your anti-inflammation going, use ice, not heat, and find somebody that can help you move that thing, all right? If you know a great chiropractor, physio, or physical therapist, that is a great time to get that thing going. But you want to use ice on this. It's my number one rule. The good news is these things are almost always gone in 2 or 3 days if you treat it right. That is how you handle that knife stabbed in your back. If you guys like all this stuff, comment below. I want to hear what you're thinking. Take care, guys.